Hello everybody. Today I shall talk on Helminthiasis. This is a condition caused by infection with parasitic worms, also known as helminths. These worms can live in the human intestines, tissues and bloodstream, causing a wide range of health problems depending on species and severity of the infections. And this can occur in any part of the world, every part of the world this occurs, and most commonly seen where there is poor hygiene. The helminthic infestations can be divided into three groups. Number 1, nematodes. All the roundworms come under this. Trematodes, the flukes, and 3, cystodes, tapeworms. Intestinal infestations by nematodes can be by ascariasis lumbricoides, also known as roundworm, hookworm, that is Ankylostoma duodenale, Niceta americanus, Trichuris trichura, also known as whipworm, Strongyloides circularis, threadworm, Enterobius vermicularis, which is pinworm or seatworm, as it is infecting the perianal area. In general, if you look at the life cycle of the nematodes, the adult worms are living in the intestine of humans, and then here they mature and then the females lay eggs. The eggs, it is again going back to the humans by two ways. One is by ingestion of the infected eggs. This mode of infection occurs in ascariasis, Trichuris trichura and Enterobius vermicularis. And another way of entry is via this larva is hatching in the soil, and then this larva is penetrating through the intact skin of the person. So this mode of transmission is occurring with Strongyloides circularis and the hookworms. So both ways these larvae enter the bloodstream. After entering the bloodstream, they pass via liver, heart, lungs, and through the lungs again it is coming up to the esophagus, and then they are again swallowed back, and then the parasite matures in the intestine of the host. Pathogenesis. Roundworm, they cause deprivation of nutrients in the host. The hookworms, the main pathogenesis is they suck the blood. So per worm can suck 0.03 to 0.15 ml of blood per worm per day, so leading to severe anemia. And then some, they interfere with the body functions mechanically, leading to intestinal obstruction, mainly seen with the ascariasis lumbricoides, that is the roundworms. Reactions due to toxic products of the parasites can occur in different parts of the different organs of the body. The mode of transmission or infection is one by ingestion of fecally contaminated material, which is occurring with the ascariasis lumbricoides, Enterobius vermicularis, Trichuris trichura. Second is by piercing the skin, that is occurring in the Ankylostoma duodenale, that is hookworm, and Strongyloides circularis. Today we'll talk in detail about ascariasis, that is commonly known as roundworms. So the name of this worm is Ascariasis lumbricoides, belonging to family Ascariidae, and then stays in the small intestine of the human, so also known as small intestinal roundworm of human. The male and female, the length ranges from till up to 30 centimeter, and females are longer than the males. In both sexes, the mouth is surrounded by 1 dorsal and 2 ventrolateral lips. So with these lips they can eat the nutrients. The posterior end of the female is straight, whereas the posterior end of the male is curved ventrally, and males are shorter than the females. One female ascaris can lay about 2 lakh eggs daily, and the uterus of this ascaris contains 27 million eggs at one time. So you can just imagine how much egg they can contain, and then 2 lakh per day eggs is quite a lot, and the lifespan of these eggs is also quite long. They can survive 1 to 2 years if they have a good environment. The eggs can remain in the soil viable for around 2 years. Epidemiology. Distribution of this worm is worldwide, seen more in the tropical countries in warmer climates, and also depends upon poor sanitation for its proliferation. So in the poor hygienic condition, they are more transmitted. Transmission is hand to mouth, and this is most prevalently seen in children because they are exposed to contaminated soil. Children do not wash hands regularly before eating, and they have a habit of putting hands in the mouth. So for these reasons, this infestation is more seen in the children. Now come to life cycle. The adult worms live in lumen of small intestine. Here they lay the eggs, and the eggs is passed in the feces. Eggs become infected in 2 to 4 weeks under favorable temperature and oxygen levels. Then infective egg contain larva in L2 stage, also known as second stage larva. So at second stage larva, this is ingested by the human, and these infected eggs hatch in the duodenum, releasing larva. These larvae burrow into the mucosal lining, enter the circulation, enters the liver, right heart, lungs. In the lungs, they molt to L3 stage. This is the third stage larva, and then they reach the alveoli, trachea, epiglottis, from where it is coughed up and then swallowed. So they pass again into the small intestine and then mature there and become sexually matured. After molting here in the intestine, they mature sexually and then start laying eggs. So this is the diagram showing the life cycle. The pink version is in the human, and then the blue one is occurring in the environment. So from the human, the feces entering the environment, there is a 2-stage cell, larva, advanced cleavage cells, and then this infected egg is again ingested by the human with the infected larva. Then after this larva enters the duodenum, they hatch and then they start piercing the mucosa, enters the circulation. So through the circulation, via the liver, heart, lungs, trachea, pharynx, epiglottis, they are swallowed back again to the intestine where they again mature, and the life cycle continues. Now come to the symptoms. Most cases are symptomless. Sometimes they show allergic responses like fever, urticarial rash. And then some, they pass the worm in the stool, and even orally through nose the worms can come out. Sometimes they cause mechanical blockage of intestine leading to intestinal obstruction. And then there is some complaint of upper abdominal distension, discomfort, vomiting, and some irritability is there. In the lungs, the larva enter respiratory system, cause small hemorrhagic foci, and then leads to episodes of cough, fever, and shortness of breath, which resembles pneumonia. So this condition is known as Loeffler's syndrome. The larva may penetrate the host mucosa and migrate to different organs like spleen, liver, lymph node, brain, and then every spot they show some inflammatory response. Penetrate intestinal wall or appendix, and then they cause local hemorrhage there. They can obstruct biliary tracts leading to cholecystitis. Obstruction of the pancreatic ducts leads to pancreatitis. Heavy worm infestation leads to poor growth, and the nutritional deficiency can be seen in children. Now come to diagnosis. In the lab, you can do stool for microscopic examination, where you look for the eggs of the ascariasis, which is characteristically having irregular surface, and the outer coat is albuminous coat with a brown color. So this brown color is due to the bile pigment absorbed from the feces. Treatment is albendazole 400 mg single dose above 2 years, less than 2 years 200 mg single dose, that is half dose. Mebendazole is another drug you can use 100 mg 2 times daily for 3 days. Parental palmate 11 mg per kg single dose can be used. If there is intestinal biliary obstruction, then piperazine citrate is the drug of choice, 150 mg per kg stat, then you give 65 mg per kg at 12-hour interval for 6 doses. No drug is effective against the pulmonary phase of the migration. And if there is intestinal obstruction, you require surgical help, they require surgery. Thank you. I'll come up again with another infestation in my next class.